Jackie Jimenez, World Health Organization doctor. Today we will be talking about the West Africa Ebola outbreak. Here with me today are Diana Rojo, national historian, Jessica de la Rosa, epidemiologist. We will also be talking about the preventions you should be taking while traveling.
Okay, Diana Rojo here, national historian. I've been researching the outbreak in West Africa known as the Ebola virus. The outbreak recently began again in March 2014 in Guinea, then spread to countries surrounding Guinea, including Liberia and Sierra Leone. CDC's 24/7 mission is to find, prevent, and stop the disease outbreaks wherever they occur. CDC is now taking a more important role and has been invited to provide leadership on the technical front by WHO. CDC has activated its return from Guinea, Liberia, and Sierra Leone in the past 21 days and have fever or other symptoms related to Ebola to keep America safe. The most difficult part about the disease is the detection of Ebola and finding everyone exposed to the outbreak. Back to Dr. Jimenez on how to prevent such an outbreak.
The outbreak is unknown. However, some doctors and researchers believe a person first comes infected with contact with an infected animal. The disease can be transmitted to others with direct contact with the blood of an infected person, also from exposure to certain objects that might have been contaminated. Ebola often has spread to families and friends through close contact with the infected. Researchers show that Ebola spreads quickly in places where you would never think, such as hospitals and clinics. This happens through staff not wearing appropriate protective gear. The way you can tell if you have been infected by the disease is by noticing certain early symptoms, such as red eyes, skin rashes, fevers, chills, anorexia, and asthenia. Treatment would include balancing the patient's fluids, oxygen status, blood pressure, and treating them for any new infections. Now, to prevent the outbreak, healthcare workers must have the capability to request diagnosis tests or prepare samples. Prevention also includes wearing protective clothing, the use of infection control, and keeping precautions when near a patient infected. That's it for me. Now over to Jessica de la Rosa with the statistics of the breakout of Ebola. Some preventative measures include stop the consumption of animal meat, isolating the sick, disposal of victims' bodies, and tracing those who had contact with the infected. Wearing protective clothing is also very important.
Now, mostly the outbreak has been happening in the countries of Zaire, Sudan, Guinea, Liberia, Sierra Leone, and Nigeria, with the percentages from 54 to 89 as the death rate. The most common situation is that Ebola was spread by close personal contact and by the use of contaminated needles and syringes in hospitals and also clinics. Also, monkeys are said to be carriers of the disease, although no scientists nor doctors have any evidence to prove it. Also, it is astonishing how many cases of Ebola have been established in just a couple of weeks. The World Health Organization, also known as WHO, has recorded more than 1,903 cases of Ebola and more than 800 reported deaths. Although experts still believe that the percentage of deaths will rise as the virus continues to spread, they are doing everything they can to put an end to this outbreak. Now on to useful information about how to prevent the contamination while traveling.
In Guinea, there has been 413 cases and 303 deaths. Sierra Leone, there has been 239 cases and 99 deaths. In Liberia, there has been 107 cases and 65 deaths.
It's an airborne disease. It is very easy to be next to a person infected and not even realize it. Does this mean that it can be easily transmitted in places like subways, trains, and airplanes? Not necessarily.
Yes, Jackie, although it is an airborne disease, Ebola does not affect a person by just breathing the same air as someone who does. But we should all take preventative measures to stop the virus from spreading outside the affected areas.
Most people who are infected with Ebola usually don't travel because they are so ill. The risk of transmission while traveling is low because the transmission is caused by close contact with blood or body fluids. Now, there may be cases where the person infected might be in the early stages of Ebola and don't know why they have the disease in their body, and may travel to another city or even another country and take the virus with them. That is where things could get complicated, but now air officials are also taking preventative measures.
Remember to always take preventative measures to keep you and your family safe.
Thank you for tuning into Channel 17.
This has been Jackie Jimenez,
Diana Rojo,
and Jessica de la Rosa.